Welcome to This Explainer. Today, we're going to tackle a massive challenge that literally every modern healthcare professional wrestles with. How do we take an absolute avalanche of daily data and somehow turn it into true, life-saving understanding? You know the feeling, right? We have more technology, more beeping monitors, and more electronic records than ever before in human history. But surviving that daily data deluge, that's not the goal. Healing patients is. So we really have to ask ourselves, how do we cross that bridge? Where do we find actual clinical wisdom in this vast sea of raw, unfiltered numbers? Well, here's our roadmap for today's explainer. We'll start by looking at the healthcare data deluge, walk through the DIKW framework, dive into understanding clinical wisdom and the over-medicalized cave, and finally, check out how AI and clinical decision support can help us improve patient quality care. Okay, let's jump right into part one, the healthcare data deluge. Before we can even start talking about clinical wisdom, we've got to face the music. Modern healthcare is literally drowning in raw, unprocessed data points. Think about alarm fatigue on a typical ward for a second. You get a single blood glucose reading of 190, a carbohydrate intake of 45, maybe a heart rate that spikes for just 3 seconds. In total isolation, these numbers have almost no meaning, do they? They're just raw facts sitting on a glowing screen, demanding your attention. And if we stop right there, completely overwhelmed by the noise, we simply can't make safe, effective clinical decisions. So how do we organize that chaos? That brings us to Section 2, the DIKW framework explained. This is the DIKW ladder. It's a really foundational conceptual model in informatics that actually explains how we as humans process the world around us. We start at the very bottom with data, translate that up into information, graduate to knowledge, and ultimately strive to reach the absolute top, wisdom. Since it's a pyramid structure, it's a great visual reminder that while raw data is literally everywhere, true actionable wisdom is actually pretty rare. It takes real intentional effort to get there. If we look at the exact definitions from the research, you can really see this progression taking shape. Data on its own? Almost meaningless. It needs context. Information adds that missing meaning, like plotting those random blood sugar numbers onto a cohesive trend graph so you can actually see a trajectory. Then, knowledge takes it a step further by discovering patterns across completely different types of information. But that top tier, wisdom, that is uniquely human. It's about deep understanding and internalization. It's knowing not just what is happening, but why it matters, and exactly what is the right thing to do about it. To put this into a daily clinical perspective, seeing the word ibuprofen in an electronic health record is just a datum. But when a system analyzes a patient's entire chart and highlights vaccination guidelines, suddenly you have actionable knowledge. Now, deciding exactly how and when to communicate that to a hesitant, anxious patient, reading the room to build trust, that requires that final, uniquely human step. That's wisdom. All right, having sprinted through data and knowledge, let's move to Section 3 and park our focus right at the top of the pyramid, understanding clinical wisdom. Believe it or not, clinical wisdom is deeply rooted in philosophy, specifically Aristotle's concept of phronesis. Now, this isn't about memorizing medical textbooks or reciting pathophysiology. Phronesis is practical intelligence. It's focusing on human actions to make the wisest, most humane decisions possible. In daily clinical life, this means looking at a complex, uncertain situation, like, say, a patient suddenly refusing a vital treatment, and knowing exactly how to blend your clinical knowledge with deep emotional intelligence. It's pulling up a chair, sitting down, and finding a path forward that deeply respects their humanity. And you can really see this dynamic mapped out here. Nursing wisdom is all about balancing the art of care, things like empathy, compassion, active listening, and self-reflection, with highly accurate technical knowledge. When you perfectly balance those internal factors, you gain the ability to exercise reflective judgment in really uncertain, high-stakes situations. That right there is the absolute essence of clinical wisdom in action. So what does this look like on the floor? Well, a wise clinician demonstrates some very specific attributes. First, they practice self-effacement. They have epistemic confidence, sure, but they leave their ego at the door and deeply know their own limits. They're never afraid to ask for a second opinion. They also draw heavily from experiential training, constantly learning from every single interaction. Because they synthesize the whole picture, instead of just reacting reflexively to random monitor alarms, they ultimately provide a much higher, safer quality of care to the patient.
But hey, finding and holding on to this wisdom is incredibly tough these days. Let's look at Section 4, the over-medicalized cave.
The research actually draws a brilliant, striking parallel here to Plato's allegory of the cave. To achieve true wisdom, clinicians have to actively step out of what the authors call the over-medicalized cave. This is that modern healthcare environment that constantly tempts us to view human beings just as a collection of diseases, failing organs, or lab results on a screen. It's a dangerous trap that literally strips the humanity right out of healing.
By stepping out of those shadows, clinicians can reclaim their core professional identity. Look, understanding pathophysiology and biochemistry is obviously vital, but true clinical wisdom means looking past the screen to deliver holistic, biopsychosocial care. It's remembering, even on your most grueling shift, that you're treating a vulnerable, complete person with a family, with fears, and with a whole life outside the hospital walls, not just a set of vitals or a blood glucose level of 190.
So, how do we use modern tech to actually support this human wisdom instead of letting it distract us? That brings us to Section 5, AI and clinical decision support. This is exactly where artificial intelligence steps in, acting as the fuel for clinical decision support systems. And let me be super clear, the goal is never, ever for the machine to replace the clinician. Instead, algorithms crunch those massive oceans of data to augment your human capabilities. It's about creating AI-assisted wisdom, serving up the precise knowledge you need exactly when you need it so your human judgment can take over without you being totally mentally exhausted from data gathering. A perfect real-world example of this is the Concern CDS system. Instead of triggering simple, annoying threshold alarms that just cause burnout, it uses machine learning to quietly analyze the subtle patterns and text in daily nursing notes and flow sheets. It visualizes patient trends and even explains the factors behind its predictions so everything is completely transparent. Basically, it does the heavy lifting of reading the data so you have the mental bandwidth to actually apply the wisdom. Ultimately, the goal of this entire framework, from data all the way up to AI-assisted wisdom, is directly tied to Section 6, improving patient quality care. Let's look at the incredible impact this has on the actual patient in the bed. First, the AI continuously monitors the flow of data in the background. Then, it synthesizes that into clear, digestible knowledge, like a visual green, yellow, or red risk score on a dashboard. Because the clinician gets this insight so early, they can immediately step in and use their human wisdom to intervene proactively. With the Concern system, this intervention can happen up to 24 hours before a patient visibly crashes. 24 hours! That is what it looks like when data actually saves lives. So I'll leave you with this final thought to ponder. Algorithms are only going to get better at crunching data, organizing information, and finding hidden knowledge patterns. But they cannot internalize, and they definitely cannot empathize. As technology masters the prediction side of health data, it is entirely up to you to supply the uniquely human wisdom required to elevate holistic, compassionate care. Thanks so much for joining me on this explainer.